Yeah, great. So Kevin and I today want to present some preliminary findings from our COVID health literacy school principals survey, which we have conducted in Germany, and other colleagues have conducted the same survey in their countries elsewhere. This is part of the COVID health literacy network, which we will introduce briefly in this presentation, Kevin. So we could observe in the beginning of the COVID pandemic that most of research and also policy agents were directed towards healthcare settings, medical research, in order to control the situation, to find a cure, etc. And kind of the education sector was, at least at the beginning, overlooked. But here are some examples what kind of COVID-related health impacts and health issues teachers, educationalists, and schools as systems faced. So COVID-19 had a serious impact on the education sector and all people involved. And so that was the reason we were passionate and compassionated to do research in this area. Okay, so, and in context of this, we have launched the COVID health literacy network. Our aim was to conduct different studies in the education sector, and for this we have contacted a lot of colleagues, many of whom are here, for example, Evancia and Katrin and Carmel, Rafaela, Majorita, Daniel is here, Jesper is here, and Simon Murphy just joined, all in some capacity take part in this consortium. And we have initially developed questionnaires. The first questionnaire was for the university settings, where we measured digital health literacy and health promotion capacities of university students. And this was the first study of our network, and this has been done in almost 40 countries. Many publications have been published already. And then we have used the same infrastructure to develop a second survey, the one in school principals, where we will present the results today. We have also developed a website, which you can access under COVID-HL EU. And we have created some infrastructure for our members to engage and communicate. And the two surveys that we have conducted so far, you can see them here, the COVID-HL University Survey and the COVID-HL School Principal Survey. And this is insofar interesting because these were among the first two surveys on health promotion and health literacy in the education sector, which these days is really a difficult task to undertake. I mean, you already had this in the discussion in relation to Nina's presentation. The education sector was impacted so hard that they shut down all research, at least in Germany, in schools, in the school setting. And so in many of our other projects, we have not been able to collect any data. And insofar, it is more significant what we were able to achieve in the COVID network. What you see now is a map of our network and the members. So you can see we have like 45 countries. The blue countries are those participating either in the one or the other survey. And we have like more than 90 researchers who are engaged with the study. And in the school principals survey that we are talking about today, of course, we are looking at a very critical population group, professional population group for all school-related health activities, especially health promotion, prevention, and health literacy. You can see that in their overall responsibility, that school principals are gatekeepers for any school innovation, such as the health promoting school, but also they are the lead actors to manage crises like COVID-19, which is what they are currently doing, even dedicated more to managing the crisis than organizing education. And compared to teachers and pupils, school principals and their experience, stress and health situation are often neglected in school health promotion. So I just mentioned that at the beginning of the pandemic, education sector was overlooked, but in fact, this population group, this professional group is overlooked in on so many levels already before the COVID-19 pandemic. And this is insofar critical because they have a lead role to play in this context. They are responsible for communication. They are responsible for development of working conditions, so both indirect and direct effects on the school everyday life. And they, of course, influence not only teachers' health and the quality of school and education, but also have an impact on satisfaction, health of pupils and other actors involved in the education sector. So, and what you see on this slide is are some technical information on our survey and the network. So initially we launched this back in February 2020 or March 2020. So around that, the discussion started. And this is a collaboration between Kevin's University, the Public Health Center of Fulda, and my university, the Interdisciplinary Center for Health Literacy Research. And both of the surveys are cross-sectional online surveys, which we have conducted by using Unipark, which is a software to collect data. And there are many similar survey applications available. We have used a non-randomized sample, a convenient sample. So this is not representative, but we have weighed the data. And in this survey, we have surveyed principals from public schools in Germany. So there are like 40,000 public schools in Germany, and we have surveyed a bit more than 2,000, and we have surveyed principals from primary and secondary schools in 4 different federal states. And in Germany, we have 16 federal states. So this is a quite good rate that we were able to achieve. And the survey was ongoing for 3 weeks from 10 March to 2nd April. So the data that we will present now is brand new. And now I will give over to Kevin, who will present the data. And Kevin, you just tell me to skip the slides, right?
We'll do so, yeah. Okay, here you can see the instruments that you have used, and the instrument that we have used is quite extensive, so I don't go too much into detail right here, but we have 4 blocks, around 4 blocks of different things that we measured. For the first thing that we measured were, of course, social, demographic, and school characteristics like sex, age, type of school, position, and the role the principal plays. We differentiated between the principal and members of the management team. The second block included the current work situation, not the work situation, so the work situation. And we asked, for example, for perceived stress by the principal, also for some kind of resources, such as sense of coherence. We also asked for self-endangering work behavior as a way of coping of how people cope with the work tasks they have to do. And we also asked for work satisfaction. So today we would like to look a little bit more on health promotion, of course, and we tried to assess health promotion and prevention in schools using a 15-item scale, which was mostly self-developed, but has its origins in previous studies. We also assessed corona-specific health literacy and other forms of health information. And finally, we also assessed health situation, or some aspects of the health situation of the principals themselves, but also we assessed also the perceived health needs of pupils and teachers as perceived by the school principal. Okay, next slide, please. Thank you. Yeah, as already said, I will focus just some snippets that we would like to give for today. So we will look a little bit more on health promotion and prevention. You can see here in brackets, it includes 15 items, mostly self-developed, but based on previous studies. For example, at our school, students are supported in dealing with worries and fears caused by the coronavirus. Then we used a health literacy scale, which is focused specifically on the corona situation that has been used in previous studies by Orkan. Then we asked the principals to rate the health needs of pupils since the corona pandemic, and the same for teachers, each including 8 items. Next slide, please. Thank you. This is a sample characteristic, and as Orkan already said, we had about 2,200 respondents in our German sample, which is quite good given the timing of the survey, given the fact that the educational sector is highly stressed and highly overloaded with different things. So we were really, really satisfied with this sample. And you see that the majority is female. The most respondents were the main principals, and only 15% were members of the school management board. And we had a fairly balanced sample with regard to primary and secondary school. Next slide, please. One of the first things we tried to do is to look at the 15-item scale. So we wanted to see if there's a kind of structure in it. And we looked, when we created these items, we looked a little bit to assess different facets of the health promoting school approach. Not all facets, but some core facets. So what we did here is a principal component analysis with some rotation. And we extracted different factors, then we did a selection, and then we did the principal component analysis again with a reduced set of items. So the final solution that we have gained is displayed here, can be seen here. We identified 3 factors. We are not fully happy right now. This is I think it's the current status, so we hope to refine it a little bit more. So we found 3 factors. The first factor is more focused on pupil-centered health promotion and prevention with 5 items. The second one is more focusing on school staff-centered school health promotion. And the second one is a little bit difficult to interpret, but it's more an overarching, an overarching factor, including things like we work closely with parents, we work closely with stakeholders outside the school setting. Okay, next slide. So we use these 3 factors for the first analysis, and these are the mean values for these 3 factors. And you see here that, and all were related to COVID-19. This is very important, all items. And you see here that schools say, or the school principals report that they implement mostly student-centered activities on health promotion and prevention, and to much more or less extent activities on the level of school staff. So, and school-centered, so the third factor is something in the middle, very close to the second factor. There's a tendency towards a gender difference, but only for factor 1. And there's an age difference, but only for factor 2, which means the older the respondents were, the more activities they report with regard to school staff-centered health promotion and prevention. Next slide, please. So this is really fast. I don't go much into detail here. We could look at each factor and look at each item separately. Just to give you a quick overview here, what schools actually do in times of COVID-19, or at least our school principals, they focus on helping students to learn how to protect from the COVID-19 protection. So all items were focusing on COVID-19, but what they do less is to support them, for example, to promote their health behavior in times of COVID-19, or giving the restrictions of the COVID-19 situation. For example, if you look at healthy eating. Next slide, please. There are no differences with regards to the second factor, so they are rated similar. So we go straight to the next slide. And here's the factor 3, school-centered health promotion and prevention. And here you see it's not the best factor, to be honest. So the reliability was also not perfect. But what they do, they have in mind that school health promotion and school performance is interlinked. And on the other side, what they do less is to think about participation, even in times of COVID-19. So it's not very surprising, because they have to do things and maybe do not have the time for participation activities. Okay, next one, please. So we are now approaching the final slides, and this is an overview about the corona-specific health literacy. So first of all, overall on top of the slide, and then differentiated by the different dimensions of the corona-specific health literacy. And here you see that 39% of the whole sample reported a limited health literacy. And if you look at the different dimensions, you see that almost 50% report problems in evaluating the health information that they are confronted with. So this is, of course, problematic, and we have found also some gender differences with regard to some dimensions, or one dimension, the same for the age differences, but I don't want to look at this right now. Next slide. And here we wanted to combine a little bit if health literacy is associated with the implementation status of school health promotion and prevention. And you see here quite interesting associations, which mean that people who report a problematic health literacy, or have a problematic or limited health literacy, also report lower implementation status for all three factors, but most substantially for factor 1, student-centered health promotion and prevention activities. And you see here the effect sizes, the eta quadrat effect sizes, eta square, sorry, quadrat is German, eta square effect sizes. So it's a substantial difference between these different dimensions of health literacy. This holds true for all factors, but is most prominent for factor 1. Next slide. And finally, we looked a little bit in the first instance on the health needs of teachers and the health needs of pupils, and we hypothesized the higher the principal perceived the health needs for teachers and pupils, the higher the implementation status of school health promotion should be. It could be, of course, one hypothesis, but it could be exactly the opposite. But there should be some form of association between health needs of teachers and health need of pupils and the implementation status. You see that here principals attach a higher health needs for pupils. So this is a sum score, where this was an 8-item scale, and they attach a high need for 5 out of these 8 health needs. And it's a little bit smaller for the health needs of teachers. And if we now go to the next slide, then you see, and this was a little bit surprising, at least for me, that there's no relationship between the perceived health needs of teachers and pupils and the implementation status of activities on school health promotion for none of these factors. You can see that there are some significant differences, but if you take into account the effect sizes, you see that this effect is not substantial, neglectable. Okay. This was really fast, I'm sorry for that, but as I said, these are only first snippets because we are in the middle of the data analysis, and it's a little bit, also a little bit explorative, although we had clear hypotheses. For us, it's really exciting to go into the data and to analyze them. So what can we see here? We conducted the first global survey, or we are in the state, we are currently conducting the survey because a lot of countries are in the phase of data collection. The first global survey on health promotion and health literacy in the education sector. This has never been done before with regard to school principals specifically. Regarding implementation, we see some differences with regard to gender, but also with regard to age, but only for some dimensions of the health promoting school, not the health promoting school approach, but with regard to school health promotion and prevention. So the third indication is that we almost 40% of our school principals report a limited corona-specific health literacy, and this is really problematic, and it is even higher for the subdimension of evaluating the health information. Point 5, higher levels of health literacy in school principals are substantially associated with the implementation of school health promotion and prevention, specifically for the factor 1, student-related health promotion and prevention. And this, as I already said, is a little bit surprising that the health needs of pupils and teachers is not associated with health promotion and prevention in schools, which means that we have to find some alternative explanations for that. Okay, so thank you very much for your that you listen to this, and I'm happy to receive some questions or feedback. Thank you so much.